Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about birth control after pregnancy. Birth control after baby's birth is something to think about before baby is born. If you don't want to have another baby very soon, discuss birth control options with your partner before baby's birth and your doctor in the hospital or at your postpartum checkup. Few women want to have Irish twins, 2 babies born within 12 months of each other. Planning can help prevent this situation. Many women breastfeed baby after birth. Breastfeeding may help prevent pregnancy, but don't count on it. Nursing a baby usually inhibits ovulation for about 17 weeks, but not always. Don't rely on breastfeeding alone if you don't want another pregnancy. Research shows 80% of all breastfeeding women ovulate before their first period. About 40% who use breastfeeding for birth control do get pregnant. In the past, oral contraceptives were not prescribed for a breastfeeding mom. Today, we have progesterone-only pills that don't decrease milk production or harm baby. They're usually prescribed after your milk supply is fully established, usually 1 to 2 weeks after birth or at your 6-week postpartum checkup. You may choose an IUD. It has proved safe for nursing. It has no effect on milk production and can be inserted by your doctor 6 weeks after delivery. Or you may choose Norplant or Depo-Provera. Either method can be started immediately after delivery. Both are safe. If you bottle feed, you have many options. You can use the regular birth control pill. A hormone-releasing patch is also a good idea. It's effective and releases the same hormones as the pill. Plan-On releases hormones to prevent pregnancy and is 99.9% effective for up to 3 years. A monthly injection of estrogen and progestin called Lunel can also be effective. A flexible ring called NuvaRing can provide you with protection for 3 weeks. Some women choose to have a tubal ligation while they're in the hospital after baby's birth. Tubal ligation is the #1 birth control method in the United States today. It's considered permanent. Surgery involves blocking a woman's fallopian tubes to prevent further pregnancies. If you decide to have a tubal ligation, doing it after delivery while you're still in the hospital can make sense. If you received an epidural for your labor and delivery, you're already anesthetized. If you have a tubal ligation, your doctor may want to examine you 10 to 14 days after you go home. He or she will check the incision to see it is healing properly and to look for signs of infection. Some birth control methods can be used whether a woman breastfeeds or bottle feeds. Barrier methods include condoms, a diaphragm, or a cervical cap. The size of a woman's cervix can change after baby, so you'll need to be refitted if you used a diaphragm or cervical cap before pregnancy. Talk to your doctor if you practice any of the rhythm methods, including periodic abstinence, calendar rhythm method, and temperature rhythm method. He or she can advise you. Birth control after baby is very important. Don't overlook this essential task. If you'd like to read about baby, check out our book, Your Baby's First Year, Week by Week. We cover many subjects dealing with baby in a weekly format. Each week is a fairly quick read. If you want to find out more about this podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It lists topics about baby covered in our Let's Explore More segments. Follow us on social media for updates, new podcast episodes, and other important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram.